Assalamu alaikum, dear viewers. I am Professor Dr. SMA Erfan, a colorectal surgeon. I have been talking to you for a long time about various diseases of the rectum and their solutions. I hope you are benefiting from it. I have been in surgery for about 30 years and in colorectal surgery for the last 10 years, providing treatment. Currently, my focus or interest is dedicated to laser proctology or laser surgery for various anal diseases, along with other colorectal surgeries. I have successfully treated thousands of patients with various diseases of the anus, such as piles, anal fissure, fistula, pilonidal sinus, through laser, which is a record for the most treatments in the world. And with your prayers, my success rate is the highest. Therefore, the treatment for these diseases of the anus, the operation is painful. The treatment that heals like magic, without any cuts or incisions, through laser, I am doing these programs to give that treatment to the people and to let them know that I am giving it. I hope you will like it. Today we will talk about a complex disease of the anus, anal stenosis. We have talked about what anal stenosis is in the previous episode. Today we will talk about its treatment, its conventional treatment. Anal stenosis, as I have said before, is a complex disease, meaning the anal canal becomes narrow. The mucosa, the skin here, if it is lost for some reason, usually through surgery or due to some disease of the anus, when that mucosa is lost, meaning it is damaged, then fibrosis occurs there, meaning a thing called fibrous tissue is formed. This forms and the anal canal becomes narrow. Normally, our anus remains closed. During a bowel movement, it opens and the stool comes out normally. But in the case of this disease, it cannot come out. For this, the treatment is to perform an operation to widen the anal canal. Now, this widening is a complex process. The process or the operation by which this widening is done is called anoplasty. In simple terms, it means to reconstruct the anus. Here from around the anus, mainly the two buttocks, the skin and mucosa of the buttocks. Fat, fascia, subcutaneous fat are brought in a special process, a plastic surgical process, inside the anus. The anus is cut and widened, and this skin is attached there. This is called an advancement flap. That is, the skin is moved from there. Its blood supply will remain intact, but the skin is moved, brought inside the anus and attached there. Another thing that is sometimes done is that the mucosa inside the rectum, which is inside the anus, is brought and attached there after cutting the anal canal and widening it. Usually that is not very successful, so it is not done much. The skin from the outside of the buttocks is used to do it. You can understand that it is a complex process, a plastic surgical process. The skin has to be mobilized from there, brought to the anus and attached after widening the anal canal. Although there are many germs in the anus, this is a very sensitive matter. There is a high probability of failure. If there is an infection, this flap that is brought to the anus can be destroyed. So it is a complex process. Through this complex process, the anus has to be reconstructed. Here, if there is a problem with the sphincter inside the anus, that sphincter also has to be corrected or widened. So anoplasty is a complex process, and its success rate depends on how successfully this complex process is performed. Therefore, so that this disease, anal stenosis, does not occur, our doctors and patients should pay attention to it. That is, when we operate, it is important that the skin and mucosa there are not lost too much. So this is a complex process, but when this disease occurs, we are solving it successfully. And now I am successfully treating several patients with this anal stenosis through laser. That is, without any cuts or incisions, through laser. We will talk about that in the next video, God willing. Until then, stay well, stay healthy, and stay with us. Thank you.